with at least 2 lakh daily new cases, we need as a country, as a nation, to recognize that the reality on the ground is much worse than what we are acknowledging. It is a reality that requires vastly different medical and social policies that if the numbers were much lower as earlier believed. So possibly with that data, it shows that we might have much higher numbers of COVID cases in the country. Well, to talk more about this, we're now joined by Dr. Rachna Kucheria, physician and founder, Doc Genie Telemedicine. Thank you so much, Dr. Kucheria, for joining us. What do you have to say about these estimates using the data that is available and, seeing these the difference between the RT-PCR test and the antigen test in the All India number, the difference being so little, 7 and 9%?
Thank you so much for having me. And you're absolutely right. You pointed out to a few things in your narrative earlier about the technique for the RT-PCR testing versus the rapid antigen. I'll point out a few other things that may be responsible for some of these numbers that we are seeing. You point out the all India rate for RT-PCR is just a 2% differential to rapid antigen, which is not how it should be, given all international as well as Delhi and Maharashtra standards. There are 4 or 5 other states where the data is quite disturbing. I'll take Odisha as an example. I'm looking at RT-PCR positivity rate of 1% and the RAT, rapid antigen, of about 15%. So I think that we need to take a look at these figures and, whoever the officials are, get down to the bottom of it. I'm a practicing physician also, and from colleagues I hear that sometimes there could be, fear in the people who are reporting the data. If it's a high PCR positivity rate, they may not report the data to create panic. In case it creates panic. So that may be one reason. The others, as you have pointed out, the technique for the RT-PCR, right from sample collection to sample storage to transportation and then running on the machine, those are highly technical and specialized functions, and staff can surely be trained to do them well, but that needs to happen and that needs to be audited. Those quality control measures have to be in place at the last mile. So that is really important. And if it's not done, then you'll see this low PCR positivity rate, which, doesn't corroborate with the science. So there's a problem somewhere and it needs to be investigated. I think that's how I would look at the data. Okay, you haven't done a great job so far, or some data is not looking good. It's not, following with the science. Now use it to propel yourself and actually identify the problems and get the right amount of testing, the correct way of testing, and the correct way of analyzing done. So that's what I would have to say.
Right. And because, we've had so much time, there have been months now that we've been living with this pandemic. We had the lockdown earlier as well. And what's really worrying also, Dr. Kucheria, is the fact that it's moving to rural areas. And again, testing there, any kind of testing is an issue. And also to get the right numbers, and there's all this constant debate between RT-PCR and antigen as well. Though we do know antigen testing helps us, even if it's not as accurate as RT-PCR, at least do a lot of testing and, faster and easier testing across the country.
Absolutely. But the caveat there is, do follow it up with the PCR test. Those guidelines were clearly out there. And recently I read a report that I think even the government, the courts pulled up one of the states that they're not doing adequate follow-up PCR tests after the rapid antigen. Somebody's come with symptoms and they are testing rapid antigen positive, they must be tested by PCR. And I think those are the kind of indicators that need to be scrutinized very, very carefully. And then you will have more confidence in the data, in the numbers that you're seeing is actually reflecting what is the ground reality.
In fact, that was in Delhi, that the court in Delhi has very good testing as well. And now the other, challenge being with the asymptomatic people. Recently, the ICMR has also said more people should be allowed to just walk in and get tested. And that is a very important change in policy, isn't it?
A huge change in policy, because the other policy previously, to take an analogy, would be the tip of the iceberg. You were only allowed to test the cases who had problems, acute or severe problems. There were those, guidelines and a prescription that was needed. So having done away, one, with the prescription, and two, saying the asymptomatics can be tested, you're now moving towards the lower half of the iceberg. And that is really important, because if those people, asymptomatics, mildly symptomatics, they're not bogged down by needing a prescription, which is yet another step and maybe expensive, then, and they get to know fast enough, spread can then be curtailed faster as well.
All right. Well, thank you so much, Doctor, for joining us on the show and talking about this very, very important issue that, the authorities also have to take into account this difference that we're seeing and the possibly that the RT-PCR tests are not being conducted properly. Thank you so much for joining us on the show.
Thank you for having me. Take care.